For the Anishinaabe, Ojibwe of Bawade, Mano Bamadaziwin means to live the good life, a life enriched by culture and community, full of love and family, thriving in health and well-being, and free from chronic disease, from cultural disconnection, and from unhealthy environments. In the Sault Ste. Marie tribe of Chippewa Indians, we strive to make living Mano Bamadaziwin the norm, not the exception. In the past 5 years, thanks to the Good Health and Wellness in Indian Country grant from the Centers for Disease Control and Prevention, our vision has become our reality.
When I look back from this journey of the 5-year GHWIC grant, we've offered so many different opportunities to our communities across our 7-county service area. We've partnered with our youth program, so our YEA program, and we have 7 YEA sites across our 7-county service area. So they've worked with us, they've partnered with us on different physical activity programs. So they've incorporated what was called a YEA Tribal Youth Fitness Group. So each of the sites have implemented that in their area. They've also participated in our kayak water teachings program. So the youth had the opportunity to learn the skills of kayaking, been taught the water teachings from our traditional medicine program. They've also been involved in nutrition programming. They've done traditional food taste testing. So really tying in our youth and starting at a young age and getting them exposed to our traditional teachings or culture and tying that back into wellness.
We've brought cutting-edge physical activity prescriptions to our members needing the most care. We've created more access to nutritional and indigenous foods. We've brought our youth to the water and our water teachings to the youth. And we've helped many more people live in smoke-free homes. These successes are paving the way for a bright and healthy future, and this is just the beginning.
Runners on your mark. Get set.
Physical activity really is a holistic approach. It's good for your mind, your body, and spirit. And that's what we in health education, we're promoting with our grants and our programs. And I know with our physical activity referral program moving forward, that's what we're going to educate our patients on.
The Physical Activity Referral Program provides medical physical activity interventions from certified exercise physiologists to Sioux Tribe members in need of care, especially those managing chronic conditions like diabetes and hypertension.
We don't want to be viewed as personal trainers. We're not here to make people bodybuilders. We're not here to, give them the best beach bod. We're here to just give them overall health. We're medical fitness trainers. We're not going to sculpt your body in 6 months. We're just here to give you overall health benefits.
We exercise a holistic approach, and our patients experience great success.
When we meet with our patients, it's not just, hey, you need to do 30 minutes of physical activity 5 days a week, 150 minutes, but we're really working with them, hey, what are some barriers you're coming across? What are you dealing with stress-wise? Just kind of digging a little deeper into what kind of things they're dealing with on a daily basis. So kind of helping them have a stronger mind, a stronger spirit, a stronger body.
According to data from the 2017 Sioux Tribe Health Survey, our tribal population faces high rates of chronic disease. 1 in 5 are managing diabetes, high cholesterol, or high blood pressure, and approximately 10% manage all 3. Many are overweight or obese and at risk for other chronic conditions such as stroke, coronary heart disease, and some types of cancer.
I think our biggest successes are just the amount of people that we've touched so far and seeing those changes that they're making. Even the small changes, just if they get a small win, you see it in their face, you see it in their demeanor, and every little small win gets them to move forward further. We've had some big, I would call them big wins, some people that made some phenomenal changes. For a lot of these people, that's huge. They've never really exercised before and they have a lot of medical conditions, so any changes that we can get them to make to see progress, that's going to help them move further.
Before GHWIC, our Sioux Tribe healthcare providers could refer patients to community health or other services such as diabetes management, nursing, or smoking cessation. But now, providers can also refer patients for physical activity assessments and prescriptions that support prevention, self-management, and treatment of these prevalent chronic diseases.
Healthcare in our country has become a lot of medication, primarily. And even some physicians that I know that I've spoken with over the years, that's not exactly how they like to see it either, but there's not as much intervention with people as more medication. So what we're doing is we're taking these people with these conditions and showing how activity, exercise, healthy diet, all these things can positively affect somebody so that we can hopefully get you off the meds. That's the goal. And a lot of these people, that's what their main goal is I take so many medications, I want to get off of some.
In addition to providing more physical activity opportunities for our tribal members, this GHWIC grant has allowed us to focus on making indigenous and nutritional foods more available in our tribal communities.
All right, so remember, do not touch that handle. It's really important for Sioux Tribe community health education to be a part of this Tribal Food Sovereignty Collaborative, because tribal food sovereignty is a growing phenomenon within tribal nations across the country and across the world. Tribal food sovereignty is really an important thing for nations and communities to really empower themselves to build their own sovereignty and to build their own sustainability. So it's really important that community health education has a role in that, and to bring these people together so that they're all working towards one common goal of increasing the food structures in the community and in the area.
Through the Tribal Food Sovereignty Collaborative, we've partnered with other community health leaders to offer canning and preserving workshops, Seasons of the UP, our Indigenous Foods class series, and Harvest of the Month events like the Boat to School program, which brings local fish from the boats to our tribal school children for their meals. And our Kayaking and Water Teachings program brings tribal youth to the water, and we teach them how to navigate and respect the water.
The Nibil Water Program started with a collaboration with our traditional medicine program. It originally started with the idea that we're water people. We grew up around this area surrounded by water, and so we should do something with our people to get them back connected to this life source around us. And so we started the program by getting kayaks and then saying, okay, we're gonna do something where we're getting our people back on the water and getting them comfortable with it. And so we purchased kayaks, we have 12, with the ultimate goal being to be able to rent those kayaks out to our membership for free. So with that, we realized, okay, we need some safety and some instruction that needs to go with that. And so we sent a few of our people to become level 1 kayak instructors through the American Canoe Association, which is the source for safety and instruction at all levels of paddle sports. And so we now have a total of 7 instructors, which we can plan to continue to expand upon so that those instructors can then take that information and share that with other people.
Additionally, one other success from GHWIC is our new Sioux Tribe housing policy, which ensures 25% of all housing units are smoke-free. This policy applies to all 9 of the Sioux Tribe's housing sites across the 7-county service area and creates 108 smoke-free homes.
So Sioux Tribe Health Education partnered with Sioux Tribe Housing Department to mail out the survey. The survey was done twice through the Good Health and Wellness in Indian Country grant. It was done 2 or 3 years ago and now the last year of the grant. A big success of that is that 25% of housing units that were already established are now smoke-free.
I think it's important that the Housing Authority is on board promoting smoke-free atmospheres for our families and allowing them to live a healthy lifestyle.
One great thing that's come from this is that any new housing that's established, any new buildings that are created are smoke-free. They're designated smoke-free.
I think it's important because we should be offering that to our residents to promote healthy lifestyles and tobacco-free living.
And finally, our GHWIC grant has helped us improve overall community health within our county and city wellness coalitions. Our work has a ripple effect that extends far beyond the tribe.
The coalition is a group that gets together and talks about what we do and how we will improve health and wellness in the community. From there, we come up with projects, and I will say that always the coalition has been led by a tribal health representative. So we talk and we think and we work on how are we going to make this happen. And then it comes back in a really nice form in an action plan that says, you can do this, in this week, in that month, this year, here's your plan. And it's all very nicely organized. So then we can actually do something.
We work with the ISD, which is Intermediate School District, and they work in the classroom. But then we have a paddlers group. They wanted to increase access to paddling, so the tribe was very helpful in getting us docks to get people on the water. With cycling, they financed racks, bike racks for people downtown. They financed riding guides for the Eastern UP and for Sault Ste. Marie. And it seems to be getting information out to the public. How do we get resources out there? Where are the walking trails? Where are the biking trails? Where are the paddling resources? And they've been very good at that.
All of these programs create more opportunities for Sioux Tribe members to be active, eat healthy, and lead commercial tobacco-free lives. To spread these messages, we've developed a comprehensive communications plan.
And so on every billboard, on every commercial, we are bringing those messages to our members to help promote healthy lifestyles and to give that message a place next to like a tobacco ad, next to these other things that take away from health and well-being and culture, and instead we want to compete with that, and we want to show this other way of life and promote that.
To do this, we are connecting back to our culture through teachings, language, indigenous foods, and activities. The GHWIC grant has given us the resources to help our tribal members live more abundant lives, and we're just getting started. Our progress is clearing the way for future programming, ensuring the health and well-being for all our communities and for generations to come.
The opportunity to serve our tribal members across the lifespan, from young child to elder. It's really rewarding to see. It's something that I'm passionate about, being a Sioux Tribe member myself. I didn't have the opportunity to learn much about my culture, my history, until my late 20s, early 30s. So to offer these programs and to tie culture back into our wellness programming is something that I feel very passionate about, and it's something that I want to see continued forward as health education as our program grows.
Mano Bamadaziwin is more than a lifestyle. It's a state of being, a guiding principle for living in harmony with all of creation.